Exosome treatment for stroke. Research on exosome therapy is only being started as a means of treating a variety of conditions, including stroke. Exosomes are microscopic vesicles secreted by cells that are packed with different biomolecules, including lipids, proteins, and nucleic acids. These molecules might be involved in tissue healing and cell-to-cell communication. Isolating exosomes, usually from mesenchymal stem cells, and delivering them intravenously or directly into the brain is known as exosome treatment for stroke. Exosomes have anti-inflammatory, neuroprotective, and tissue repair properties that aid in functional recovery. The purpose of clinical studies is to ascertain the best treatment protocols, safety profile, and effectiveness of this intriguing medicinal strategy.